Hello and welcome to Occupational Health and Safety class. Occupational Health and Safety is a field of study which look at the health of an individual in his place of work. But before we go in depth into the course, let's look at the different components of this course. When we said occupation, we means is a job, is an activities, is a skill, okay, or it's something that an individual is engaged in doing in order to earn livelihoods. Or it is the activities that a person is engaged in for the sake of benefit or profits. Okay, so the occupation of man, it can be farming. Okay, when we say farming is your occupation, that means that's solidly what you do. That's where you spend your time, that is where you spend your resources, and you expect that at the end of it, you will be able to sustain yourself or to get profit from the farm activities. Okay, like we have students, the purpose of you being in the school environment is to learn, and at the end of it, you obtain your certificates and you make use of it for the betterment of your future. So you see, the school now becomes your occupation. That is at that moment that you are schooling. So we have occupations like carpentry, we have blacksmithing, we have occupation like drivers or driving. We have occupation like teaching, medical doctors, health workers, and others. So, in this course, we look at the relationship between man and his work environment. Does this relationship promote your health or does it deteriorate your health? You know that the place in which you spend most of your time has a negative or positive effect on your well being, because the time in which you spend in your working environment can affect you directly. Some people spend 8 hours, 10 hours, and so in their working environment. So, when that environment is not healthy, know that your life is also in danger. So, in this course, basically, we look at those components, those factors, those things that we can actually do in order to ensure that workers are healthy in their working environments. And know that when a worker is healthy, the worker tends to be productive. But when a worker is sick, the productivity of that worker becomes low. And know that you spend more money in controlling or treating occupational diseases than the money you use in preventing occupational diseases. Okay, so if you are an employer or an employee, make sure that you put the proactive measures in place in order to ensure that your workers are healthy, and also as a worker to ensure that you are healthy in your working environment, because you end up gathering the money, you end up doing the job, you end up acquiring whatever you want to acquire, but your health might be in danger. So, in occupational health and safety, we learn how to educate workers and also their employers on how to take care of their health, on how to use preventive measures, because there are some occupations that you cannot rule out hazards or dangers within that working environment. There are some working environments that the occupation itself is a hazard or is a danger to human health. But you cannot totally stop people from doing it. So what do you do as a remedy? You educate them on how to stay safe, on precautionary measures when carrying out those occupation or activities. We have so many occupation that also has a detrimental, effect on the environment. We have some occupation like mining. You see, people are tilling or they are excavating the ground with the aim of removing mineral resources. And during this process, the environment is exposed to toxic substances. And also, humans that are engaged in these activities are also exposed to different dangers. So, the ground actually buried some toxic substances or some mineral resources that are not supposed to come in contact with man directly, or water bodies or animals. So, in occupational health and safety, we give you adequate information. And also, as an occupational and health officer or occupational and safety officer, it is your duty to go to occupational environments to dictate those factors that are hazardous to the workers, and then to also provide or to proffer solution on how these workers can stay healthy within their working environments. In developing countries, this aspect of health is actually neglected. You see people working under a hazardous circumstances, or people operating dangerous machines without using protective measures. Let me give you an example with people that all these scavengers, or people that pack waste and transfer them to other to a dump site or to final management treatment plants. Sometimes you see them without their nose masks. You see them without hand gloves. You see them without a rain boot and overall. You see somebody packing hazardous waste just with a bare hand. And after that, the person might use ordinary water to wash his hand, or sometimes the person might not even wash his hand at all. And then he will handle for food substance, or his food, and he will eat it. And know that the person is coming from a what? A dirty environment or unhealthy environment. So by doing that, the individual is exposing himself or herself to what? To danger. Occupational health and safety is kind of a little bit difficult in developing countries or in the world entirely. Reason being that, when you are exposed to diseases like malaria, within a short period of time, you'll be able to manifest the clinical sign and symptoms, and then you treat the disease. But occupational diseases, some of the, not all anyway, but some of these occupational diseases are actually chronic in nature. That is, they stay for a long period of time in human body before they will manifest. And when they manifest, sometimes it's difficult to trace their origin. You see, that's why we are having some diseases today that you hardly, determine the causes of those diseases. So when we say you prevent yourself, it's actually the best thing to do. So occupational health and safety focus in this area. It focus on industrial hygiene. It focus on occupational psychology. It focuses on agronomy, that is relationship between man and machine. Not only diseases, but also some physical factors that can affect the worker in a negative way, such as stress. Okay, stress is also an occupational disease or hazard that can actually affect the worker's health. Okay, so basically, this is an introductory class. So I want you to have a wider scope on this course, for you to have the understanding that whatever we will be discussing in this course, it's strictly focusing on the occupational environment and the workers. In developing countries, we have some constraints. We have some things that are actually hindering the effective implementation of occupational health and safety. We have limitations like poverty. Some people are, even if they are aware of the danger because of their financial background, because they are looking for daily bread, they are willing to carry out their activities no matter the circumstances. And also we have some situations like lack of knowledge. Okay, lack of knowledge is a limitation that people are not even aware. Sometimes you see some people rearing things like chicken or keeping animals in their own bedroom, thinking that it's just a normal thing, not knowing that there are hazards that are associated with that. People going into mining ponds without protective gadgets, people exposing themselves to different hazards without knowing the implication of what they are doing. So you see that lack of knowledge is another hindrance or is a limitation to the implementation of occupational health and safety. And also poor trained personnels. We don't have people that are adequately trained in the area of occupational health and safety. Also, we have some constraints or limitations like poor law enforcement. When you check, even in Nigeria or other developing countries, let me be specific. In Nigeria, we don't have recent laws or constitutions that in relation to occupational health and safety. Most of the constitutions are actually outdated, and most of them are not even implemented. Even when we have the laws, do we implement them? Is the enforcement agency, are they even aware of these laws that we have on ground? So you can see poor enforcement of these laws actually make it difficult to implement occupational health and safety. Some employers of labor are not aware of this, and also we have poor records keeping. Okay, do you know that most of these occupational hazards and occupational accidents are not recorded? Because if you are going into an occupation and you know the hazards that is associated to that, or you know that someone has died or injured because of that working process, you will be careful. But most of these occupational hazards are not recorded. Okay, so there is inadequate information about that. Inadequate information about that. That makes people to go into the occupation without checking the history, or having adequate knowledge on the danger that is associated to that. If you are an employer, okay, know that you have the responsibility to ensure that your workers' health is protected. We have occupational laws actually that backed a worker. Okay, we have a compensation act and others that spell out that if you employ someone and the person becomes sick in the process of carrying out the job, and if it is a negligence from the side of the employer, is the duty of that employer to take care of that employee, or the employee has the right to claim some compensation, and in respect to that. So you see, when the people don't have adequate knowledge, it becomes difficult for them to even stand for their rights. So it is your duty now as a health worker, as an environmental health or a public health professional, to actually implement these measures to make sure that everyone stay healthy in his working environment. And we have the rights, we have the laws that are spelled out with their sanctions, that when an employer is negligent from as in putting preventive or protective measures, the worker or the employer now can sue the employee can sue the employer actually, and claim some compensation. So it's actually a lovely cause. I'm just bringing us the introduction actually, the basic things that you would expect from this course. Okay, all through the course, I'll be taking you through occupational hazards, occupational diseases, occupational medicine, occupational health programs. Okay, all those things that are made up an occupational health and safety. So stay tuned. In the next class, we will be looking at the definition of occupational health and safety that is given by the World Health Organization and ILO organization. They came together to give us a basic definition of what an occupational health and safety is. And as the occupational health and safety officers, what do you expect? What are your duties? Okay, what are you supposed to do? What are the implementive measures that you put in place in a working environment? So thank you for listening. Bye.